Okay, the next class is about skin and vesiculobullous lesions. First question is, a flat circumscribed discoloration of the skin or mucosa that may vary in size and shape is referred to as macule. So it is a flat circumscribed discoloration only. Okay, it may be of the skin or mucosa. It can vary of the size and shape, and that is called as macule. Next question. A 21-year-old woman complains that regular gentle brushing of her teeth is painful, besides causing profuse bleeding. Oral examination reveals a loss of epithelium from the attached gingival of the both arches. Which of the following dermatological problems is this patient most likely to have? It may be benign mucous membrane pemphigoid. Okay. Next, which of the following is an oral manifestation of the lichen planus? In lichen planus, there will be white radiating lines on the buccal mucosa. Next question, anti-nuclear antibodies are seen in systemic lupus erythematosus. Next question, which of the following disease of the skin is the most likely to be associated with partial anodontia? Once again, which of the following diseases of the skin is most likely to be associated with a partial anodontia? It is hereditary ectodermal dysplasia. Which of the following is absent in crust syndrome? Endocrine disorders are absent in crust syndrome. Those which are seen in crust syndrome include calcinosis cutis, telangiectasis, and Raynaud's phenomenon. Okay, you have to remember both. Then, Nikolsky's sign is positive in bullous pemphigus. Monroe's abscess are seen in psoriasis. In lichen planus, the basal cells which are shrunken with an eosinophilic cytoplasm and with a pycnotic and fragmented nuclei are called as civet bodies. Once again, in lichen planus, the basal cells which are shrunken with eosinophilic cytoplasm and with a pycnotic and fragmented nuclei are called as civet bodies. Next, Greenspan syndrome is associated with hypertension, diabetes, and lichen planus. A fluid-filled elevated lesion of the skin is called as bulla. Any fluid-filled elevated lesion of the skin is called as bulla. Which of the following is not a type of lichen planus? Verrucous. There is no such type of lichen planus except atrophic, hypertrophic, and erosive types of lichen planus are seen. Unusual extensibility of the tongue is a characteristic feature of Ehlers-Danlos syndrome. Okay, unusual extensibility of the tongue is a characteristic of Ehlers-Danlos syndrome. Next, Sang smear test is used in the diagnosis of pemphigus. Sang smear test is used in the diagnosis of pemphigus. Koebner phenomenon is seen with psoriasis. Darius disease is associated with vitamin A deficiency and involvement of the oral epithelium and skin. Once again, Darius disease is associated with vitamin A deficiency and involvement of the oral epithelium and skin. Erythema multiforme is an acute self-limiting disease of the skin and oral mucous membrane. Erythema multiforme is an acute self-limiting disease of the skin and oral mucous membrane. Scleroderma involves tightening of the oral mucosa and periodontal involvement, multiple palmar keratosis, and Raynaud's phenomenon. In ectodermal dysplasia, all of the following structures are affected. In ectodermal dysplasia, hair, teeth, and nails are affected. Pemphigus is characterized by acantholysis. Histopathologic study of the lichen planus shows presence of T lymphocytes predominantly. Next question is, which of the following is inherited as an autosomal dominant trait? White sponge nevus. Lupus erythematosus we can cancel. Lupus erythematosus cell phenomenon in peripheral blood is seen in systemic lupus erythematosus. Next, lichenoid reactions are mainly due to intake of certain drugs. Intraepithelial vacuolation with the formation of vesicle or bulla intraepithelially above the basal layer is characteristically seen in pemphigus. Once again, intraepithelial vacuolation with the formation of vesicle or bulla intraepithelially above the basal layer is characteristically seen in pemphigus. A 40-year-old woman reports with a complaint of burning sensation in the mouth. Clinical examination reveals lesions consisting of radiating white lines in a retiform arrangement affecting buccal mucosa, tongue, lips and gingiva bilaterally. An incisional biopsy is suggestive of lichen planus. The following are different clinical forms of lichen planus, except we have already discussed this question. There is no verrucous type of lichen planus, except we have atrophic lichen planus, bullous lichen planus and hypertrophic lichen planus are there. Okay. Next, immunofluorescence test is positive in pemphigus vulgaris. Immunofluorescence is seen at the basement membrane as a patchy distribution in pemphigoid. Once again, immunofluorescence is seen at the basement membrane as a patchy distribution in pemphigoid. Erosive lichen planus resembles which of the following? It resembles desquamative gingivitis. A 60-year-old has got severe bulla and target lesions which erythema around halo and genital lesions. Stevens-Jones syndrome. Next, target lesions are observed in the case of erythema multiforme. Fine needle aspiration biopsy is indicated to diagnose pemphigus. Which of the following are seen in ectodermal dysplasia? Hyperpyrexia can be seen, protuberant lips and frontal bossing, defective or absence of the sweat glands. All of these are seen in ectodermal dysplasia. Intraepithelial bulla are found in pemphigus. Okay, intraepithelial bulla are found in pemphigus. Next question is, lichen planus can undergo malignant change. Oral lesions are not seen in psoriasis. Next question is, oral, ocular and genital lesions are seen in Stevens-Jones syndrome. Wickham striae are seen in lichen planus. In which of the following disorders is circulating antibody directed to intercellular cementing substance of the stratified squamous epithelium is observed? Pemphigus vulgaris. I'll read the question once again. In which of the following disorders is circulating antibody directed to intercellular cementing substance of the stratified squamous epithelium is observed in pemphigus vulgaris? White radiating lines can be observed in case of lesions of lichen planus. Oral diagnostic features of scleroderma include all of the following except. So we can change the question. Oral diagnostic features of the scleroderma include a hard and a rigid tongue, pseudoankylosis of the TMJ, difficulty in swallowing. All these three features are involved. Primary lesion in lichen planus is a papule. Bulla formation after striking an intact skin or mucosal surface is known as Nikolsky sign. Once again, bullae formation after striking an intact skin or mucosal surface is known as Nikolsky sign. Next question is, lupus erythematosus it is an autoimmune disorder. Psoriasis is associated with the geographic tongue. Formation of multiple pinpoint bleeding spots on the scratching the skin is a characteristic of psoriasis. Mucocutaneous lesion associated with the neoplasia. It is paraneoplastic pemphigus. Once again the question, mucocutaneous lesion associated with neoplasia. It is paraneoplastic pemphigus. Next, Steven-Johnson syndrome involves type 3 hypersensitivity reaction. Next question is, mucocutaneous lesion associated with neoplasia, it is paraneoplastic pemphigus. Next, Steven-Johnson syndrome involves type 3 hypersensitivity reaction, which is a degeneration disorder characterized by atrophic changes of the deeper structures, example fat, muscle, cartilage and bone, involving one side of the face. It is Parry-Romberg syndrome, which is a degeneration disorder characterized by atrophic changes of the deeper structures involving one side of the face. It is Parry-Romberg syndrome. A 3-year-old patient has extensive vesicles on the lip, tongue, oral mucous membrane. After 2 to 4 days, vesicles rupture followed by pseudomembrane formation, and also some dermal lesions are seen. What will be the diagnosis? It is erythema multiforme. A 3-year-old patient has extensive vesicles on lip, tongue and oral mucous membrane. After 2-4 days, vesicles rupture and followed by pseudomembrane formation, and also some dermal lesions are seen. What will be the diagnosis? It is erythema multiforme. The primary cause of acantholysis in pemphigus vulgaris is autoimmunity. Which sites are characteristically affected in Steven-Johnson syndrome? The sites affected are conjunctiva, genitalia and oral mucosa. Histological clefts in lichen planus are, they are called as Max Joseph spaces. The swollen degenerating epithelial cell due to acantholysis is, it is Sang cell. Ectodermal dysplasia is an X-linked recessive disorder. Pathologic calcification is seen in scleroderma. Joint erosions are not a feature of systemic lupus erythematosus. Multiple pulp stones are seen in Ehlers-Danlos syndrome. Greenspan syndrome is associated with lichen planus. Psoralen ultraviolet A, that pure therapy is advised in carcinoma in situ. In cicatricial pemphigoid, which antigen is bound by IgG on the epidermal side of the salt split skin technique? That is, we have 10, 5, 17 collagen. Next, subepithelial vesicles are characteristic of all of the following except. So we can change the question. Subepithelial vesicles are characteristic of all of the following. That includes bullous pemphigoid and cicatricial pemphigoid and epidermolysis bullosa acquisita. All are diseases of the skin that include erythema multiforme, keratosis follicularis and psoriasis worm lesion. Hydrophic degeneration of the basal cell of the stratum germinativum is a feature of lichen planus. Butterfly rash is typically seen in systemic lupus erythematosus. Caffeolate macules are seen in von Recklinghausen's neurofibromatosis. Next question is, Ehlers-Danlos syndrome is autosomal dominant. Oral lesions associated with the ulcerative colitis is pyostomatitis vegetans. Xeroderma pigmentosum is characterized by inability to repair sunlight-induced damage to DNA. All the following are inherited disorders of the connective tissue except. So we can change the question. All of the following are inherited disorders of the connective tissue that include Alport syndrome, Marfan syndrome and Ehlers-Danlos syndrome. Next, fishnet patterns in pemphigus vulgaris is seen in which of the following test? It is seen in direct immunofluorescence. Next question is, which of the following is not a lichenoid reaction? We can change the question. Which of the following is a lichenoid reaction? That include graft versus host disease, fixed drug eruption, and secondary syphilis. A typical example of the immunologically mediated collagen or vascular connective tissue disorder is lupus erythematosus. False about mucous membrane pemphigoid. So we can change the question again. True about mucous membrane pemphigoid is twice in females, autoantibodies towards the basement membrane protein, and oral mucosa is most frequently involved. Next, which of the following individuals shows susceptibility to dental caries? That is epidermolysis bullosa. And autoantibodies anti-RO and anti-LA are completely absent in rheumatoid arthritis. Oral lesion seen in hepatitis C is lichen planus. Bullae caused by pemphigus are seen more often in women.